Good morning, Pumps and Pipes. My name is Joanna Nathan, and I am the CEO of Prana Thoracic, where we are building the future of early innovation in lung cancer. I'm very excited to tell you a little bit about what our company is doing and specifically how it is related and how we've learned a lot from kind of across the industries that we have here in Houston. So lung cancer is the #1 cancer killer in the US. It kills more people than the next 3 major cancers combined. If you are diagnosed with lung cancer today, there is a 60% chance that you do not survive the next year. One of the reasons for this is because unlike other cancers, breast, prostate, etc., we have not historically screened for lung cancer on a regular basis. Now this is changing. There are now more than 15 million patients a year that are eligible for annual lung cancer screening in the hopes that we would be able to catch it earlier and intervene earlier. However, we're still not seeing great uptake here. And one of the reasons we believe that this is happening at Prana is because there aren't great tools right now available to provide these patients with a definitive diagnosis on what's going on in their lungs after they've been screened. So today, this is what the standard of care looks like. A patient comes in with what's called a pulmonary suspicious nodule. Something shows up on their CT scan or X-ray that looks a little suspicious. There's a couple different options for them. The first is to try to go after it with a needle. The challenge with needles is the smaller and the earlier the nodule is, which is when you want to catch it, the more trouble physicians have getting an accurate and appropriate sample. So what ends up happening is we tell a lot of these patients that they don't have cancer when they actually do. Another option is what's called a wedge resection. This is an invasive surgical procedure where it's kind of what it sounds like. You wedge out that whole section of lung that contains that nodule. Now, while you certainly get a definitive diagnosis here, a lot of the time, that patient doesn't even have cancer. So what was actually found in a major study was that in 20% of the cases where you've done this major surgical intervention, it was found that it was done on a benign nodule. So now you've impaired that patient's lung function for the rest of their lives, and they didn't even have cancer. The last option is called watchful waiting. So this is where a patient is told, hey, we saw something, we spotted something in your lungs, and yet we are not comfortable intervening yet. We don't know what's going on. We don't have a great tool to intervene. And so we're gonna ask you to come back every 6 months for another CT, for another X-ray, for whatever it might be, and follow you. Now, cancer in 6 months can progress very quickly, and I don't know about you, but at least for me, that would not be a satisfactory answer as a patient. So based on this landscape, there's a clear need for a minimally invasive, lung-sparing tool that gives patients that definitive diagnosis, that certainty and peace of mind on what's going on in their lungs. So what do you do when you're trying to get more data under the surface and not disturb all of the other layers over it? You core. Now, coring is not a new technology. There's actually evidence of coring all the way back to the ancient Egyptians. They cored into granite. I learned as I was putting together this presentation that this is a very hotly debated topic in Egyptology. We actually still don't know how they did this, if they had some kind of advanced technology or some other tools. But they have been, the ancient Egyptians were core drilling thousands of years ago. My colleagues in oil and gas certainly are familiar with this. A lot of the time you have to core to optimize, to get samples, to analyze what's going on thousands of feet under the earth and optimize for production. So my colleagues in space exploration certainly are familiar with this as well, as we sent Perseverance to Mars and to gather rock samples to look for signs of that ancient microbial life. Now we have taken that same ancient idea of coring and put it into a medical device called ThoraCore. Some of the challenges with lungs specifically and resecting lungs, coring lungs, are this is a very complex organ. There are complex networks of both blood vessels and airways that you have to deal with. There's unique tissue properties that make the lung a particularly challenging organ to core into. It's stretchy, it's spongy, it's quite challenging to core into. And finally, there are, because of where it is, under the ribs, because nodules can often be buried under layers of lung, under layers of tissue, these nodules can often be quite difficult to target. So our technology works by, in a simple way, we have a needle that is placed under CT guidance near that nodule. We anchor into that nodule and then deploy our device over that needle. So what our device does is it cores, kind of like a corkscrew, seals, so make sure we're sealing all the blood vessels and airways along the way down to that nodule, and cuts down to that nodule, and then we're able to resect that whole slug of tissue. So where you might have had, with a needle, a handful of cells to smear across a slide, today, with our device, you might be able to get intact lung tissue. So now not only can you say this patient does or does not have cancer, you can run molecular sequencing, you can do all of these additional tools that we have now to create the best treatment pathway for that specific patient. Our tool not only allows physicians to intervene earlier, it also benefits the system in reducing OR time by providing a minimally invasive solution, as well as patient length of stay. And most importantly, again, it gives patients that certainty and peace of mind. As soon as you see a nodule, there's an opportunity to intervene and know what's going on. There's about 2.5 million nodules today in the US when you combine the existing market and the screening market that's coming online as we begin to screen more and more for lung cancer. We're pricing similarly to other surgical tools, and that's a massive market opportunity just in the US, just in lung cancer diagnosis. And of course, there are opportunities to expand to other lung disease, other geographies, which expands kind of the impact that we can have. So to date, we've done a couple of animal studies where we've survived the pig, and I'll show you an example of that in a minute. We've done many, many animal studies in large animals where we've shown that we can safely excise lung tissue without the big complications that surgeons normally are concerned about in any lung surgery, which are bleeding and air leak. So this is an animal study that was done just down the street in the Med Center at Texas Heart Institute. This is Dr. Billy Cohn, who is an inventor on a lot of our patents, and he right here is placing that needle, deploying our device over the needle after it's been anchored into, a faux nodule. And then you can see here he's coring, running that corkscrew down to that nodule, and then pressing down on that handle to seal, and removing the device once he's done. And you can see here in a minute that you get an intact sample of lung tissue, and that's the little guy a few days after surgery doing completely fine without any of those complications I talked about. We have an incredible team of experienced medtech entrepreneurs, engineers, and surgeons. Our technology was actually developed by my co-founders, Drs. Fischel and Boyle, who developed this out of frustration with not having a solution like this for their patients as thoracic surgeons. And we're supplemented by an incredible board of clinical advisors, including Billy, who I mentioned, as well as some folks at MD Anderson in thoracic surgery and interventional radiology that are supporting the development of our device. That's all I have for today. We're Prana Thoracic, and we're building the future of early intervention. Thank you so much for having us. If you're interested in learning more, please come find me at the break or our CEO, Ken Boucher, who's in the audience today. I'd love to share more with you about our journey. Thank you.